Welcome to Raaonline. Today's lecture topic is ankle joint. As per CBME, this is a competency we are going to see in detail in this lecture. Describe the type, articular surface, capsule, synovial membrane, ligaments, relation, movements and also the muscles producing it, blood and nerve supply of ankle joint. To describe any synovial joint in our body, these are the headings we need to follow. Since the ankle joint is also a synovial joint, these are the headings we are going to discuss in this lecture. The first heading is the type of joint, articular surface, capsule, synovial membrane, ligaments, relations, factors contributing to the stability of the joint, blood supply, nerve supply and movements produced by the joint. Finally, clinical anatomy. There are various joints present in the distal end of the lower limb. These joints are closely related, so we will see one by one. So the first image represents the distal tibiofibular joint, which is a joint present between the lower end of tibia and fibula. The second image represents the talocrural joint, which is formed between the lower end of tibia, fibula and talus. This talocrural joint is also called as ankle joint. And third image, you can see the subtalar joint, which is present between the talus and calcaneum. So in this lecture, we are going to see in detail about the ankle joint. So this joint is also called as talocrural joint or Hock joint. So this joint is unique because this joint is very stable as well as it is very important for the mobility of the individual. This is a strong weight bearing joint which is present on the lower end of lower limb. Coming to the type of joint, so as I have discussed already, the ankle joint is a synovial joint which is hinge variety. Since it is a hinge variety, the movements happens only in one axis. So this joint is also called as uniaxial joint. The various bones takes part in the ankle joint are, this is a tibia, the lower end of tibia and the lower end of fibula and the talus bone distally. Since there are more than two bones articulating in the ankle joint, this joint is also called as compound joint. So in this image, this is a tibia which is present on the medial aspect. This is a fibula which is present on the lateral aspect, and you can see the upper articular surface of talus which are forming the ankle joint. Now we'll see the articular surfaces. To describe the articular surface, we are dividing the articular surface into proximal and distal aspect. On the proximal aspect, the articular surfaces are formed by the inferior articular surface of lower end of tibia along with medial malleolus. Laterally, it is formed by the lateral malleolus of fibula. In between these two bones, on the posterior aspect, there is one more important structure which is not bony in origin. So this ligament which you see in this picture is the inferior transverse tibiofibular ligament, which are nothing but lower deep fibers of the posterior tibiofibular ligament. So joining these three components, that is a lower end of tibia, fibula along with this inferior transverse tibiofibular ligament, these three components together we call it as tibiofibular mortise or tibiofibular socket. So which forms a proximal articular surface. And before going to the distal articular surface, I just want you to learn the skeletal framework which are forming the dorsum of foot. So this is a talus bone, you can see here, this is a calcaneum, and just in front of the talus you can see the navicular bone, and just anterior to the navicular there are three bones present. These are called cuneiform bones, medial, intermediate and lateral. On the lateral aspect you can see the cuboid bone. These are the 7 tarsal bones which are present in the foot. So these are the 5 metacarpal, these are the phalanges. Out of all these bones, the bone which takes part in the ankle joint is the talus. So we are just concentrating only the talus part. So the talus has 3 parts. So this is the head of the talus, and just behind this the constricted part is called neck, and behind this large area is called body of the talus. On the body we have superior surface, this is a medial surface and this is a lateral surface. So this superior surface is also called as trochlear surface. On the medial aspect, you can see the comma-shaped articular surface. On the lateral aspect, the body of the talus has large triangular articular facet. So basically the medial surface, superior surface and lateral surface of the body of the talus takes part in the ankle joint. So all the three surface together we call it as trochlear tali. Here if you see the surface of this trochlear surface, anteroposteriorly this surface is convex and transversely this is concave. So the appearance of this surface looks like a pulley shape. So that is why this surface is also called as trochlear surface. On the medial aspect, you can see the comma-shaped articular surface which articulates with the medial malleolus of the tibia, whereas this trochlear surface articulates with the lower inferior surface of the tibia. On the lateral aspect, the large triangular articular facet articulates with the fibula, lateral malleolus of fibula. So this is actually the right talus bone. So this is a superior view and this is an inferior view. You can see the articular facet present on the inferior aspect which contributes to the subtalar joint. So if you closely look at the body of the talus, on the anterior aspect it is wider when compared to the posterior aspect. So the articular surface of ankle joint resembles that of monkey wrench grip or pincher grasp when you are holding an object by the index and thumb. So this holding object represents the talus, the index and thumb represent the proximal articular surface formed by tibia and fibula. Coming to the capsule of the ankle joint, the capsule is proximally attached to the articular margins of both tibia and fibula, except on the postero-superior aspect, it is attached to the inferior tibiofibular ligament. On the distal aspect, it is also attached to the articular margins of the talus, but on the dorsum of the neck of the talus alone, little bit of neck region is included within the capsule of the ankle joint. So except in two places, the capsule will not attach directly to the articular margin. Those are the inferior tibiofibular ligament on the posterior aspect and the dorsum of neck of talus on the antero-inferior aspect. If you see the collagen fibers arrangement within the capsule, on the anterior aspect which was removed here and the posterior aspect, the capsule is thin to allow the movements of the ankle joint, namely flexion movements. On the lateral aspect, the capsule is reinforced by a thick collateral ligaments, namely medial and lateral collateral ligament. So basically the capsule is thin on the anterior and posterior aspect, whereas on the medial and lateral aspect it is strengthened by the collateral ligaments. You can see the lateral ligaments here.